doctors.
Mr. President, thank you. I want to first follow up on Jeff's question, because the person you were standing next to, whether you know who he is or not, tested positive for coronavirus. Dr. Fauci said this morning, if you stand next to somebody who tested positive, you should self-isolate and get a test. You say your White House doctor is telling you something different. Who should Americans listen to? And my second question
I think they have to listen to their doctors. And I think they shouldn't be jumping to get the test unless it's necessary. But I think they have to listen to their doctors. And I mean, I don't know, I haven't seen the picture. Somebody said there's a picture with somebody taking a picture with me, but I haven't seen it.
Well, doctors have said you might have it even if you don't have it. Question, Mr. President, that was a follow-up.
Go ahead. Yeah.
I know there's been a lot of talk about testing. I just want to make sure we're clear, though, because we've been hearing from doctors who say, as of today, they still can't get patients tested who need a test. So as of today, can everyone who a doctor wants to have tested get tested? And if not, when?
Well, that's been true for a while, but I'll let Mike, why don't you answer that, Mike?
Well, as the President said, and Dr. Fauci has articulated, the nature of our current system where the CDC has samples sent and tests are performed, or state labs perform tests, or in some cases university and hospital labs perform tests, is generally adequate for an infectious disease or for people getting a diagnostic work done. But given the sheer scale of this, the President tasked us with bringing together this extraordinary public and private partnership. Today, by some estimates, when you add all the labs together, and today the President made it possible for every state in the country and their state labs.
Tonight, more signs of the world's biggest economy creaking to a halt. Disney today canceling the production of all live-action films in the pipeline. Hours later, Netflix, then Warner Brothers following suit, halting productions in the U.S. and Canada. Universal and Disney also shutting their theme parks. The U.S. entertainment industry is valued at an estimated $700 billion a year, and the shutdowns are engulfing sports too. NASCAR and Golf's Masters announced postponements today, joining nearly every major league sport, the NHL, Major League Baseball, and soccer, and others calling a timeout, including the NBA. The Utah Jazz's Rudy Gobert, who tested positive after mockingly touching reporters' microphones at a news conference, apologized, but his team is now testing dozens of people. The Boston Marathon pushing the race to September, and the ripples reaching down into local economies too. In hard-hit Washington state, overall business is down 10%. The state hammered with over 30 coronavirus deaths. Hotel spending down more than 50%. Restaurants down 30%. The ever-present threat of quarantine triggering panic buying. Now, these shelves are bare. Typically, they're restocked every night. But economists tell us with the global supply chain screeching to a halt, shelves like this might just stay bare.
Farmers aren't going to be able to get their work done. Truckers aren't going to be able to ship the food from the farm to the store shelves. Store shelves aren't going to get stocked. It's going to be difficult to just manage through every day.
Nick Vyas is an expert on the global supply chain. Would you say that this is the biggest economic interruption that we have seen in our lifetimes?
I think that when the dust settles, we will look back and this will probably be one of the major catastrophic event.
But economists seem to agree there will be a recovery, a distant hope brought nearer by the latest Instagram update from Hollywood's most relatable man, Tom Hanks, still in isolation after contracting the virus in Australia. Hanks encouraging fans to take the advice of experts and take care of themselves, and in a wink to his hit movie, A League of Their Own, reminding folks there's no crying in baseball.
That from Tom Hanks today. Matt Gutman joins us live tonight. And Matt, we wanted to get back to that graphic you and I showed earlier this week that really drove home why officials are trying to slow this down, why the president declared a national emergency today. Many health officials say the U.S. needs to do everything it can to flatten the curve, as they say. You see the dotted line there across the middle? That's what hospitals can handle, and if we don't slow it down, the red there shows the need spiking well above what hospitals can actually handle. The thought being if we slow it down, perhaps we'll be able to keep it within what our healthcare community can actually handle. But Matt, I wanted to ask you tonight if there's a run on supplies, because people have seen those empty store shelves across this country. If there's a disruption in the supply chain, are there things governments can do to actually help?
And we're already starting to see some of those actions, David. The federal government and state officials tell me that these are already happening. National Guard deployed in New York. The governor of California issuing an executive order essentially allowing him to commandeer private property. And federal officials tell me that it's in their pandemic plan to deploy the military to prevent the supply chain and infrastructure from being interrupted. David?
Matt Gutman in California tonight. Matt, thank you. And the wild week in the financial markets ended with a recovery today, a day after the worst point loss ever. The Dow closing up more than 2,300 points today, a return of 10%, gaining back nearly all of that loss. The back and forth continues. Economists say expect this volatility to continue. Tonight, the World Health Organization says the epicenter of this global pandemic has now shifted from China to Europe. Italy alone just today reporting another 250 deaths in just the past 24 hours. And at midnight tonight, that new travel ban from Europe to the U.S. goes into effect. Americans racing to get home amid confusion. The White House trying to make it clear now that the ban will not affect Americans, but many said that clarification did little to ease the alarm. ABC's Maggie Rulli from London tonight.
Tonight, Americans racing to get home before new travel restrictions on Europe kick in at midnight. Many Americans are getting on this train to Heathrow trying to catch what they think could be some of the last flights back to the U.S. President Trump this afternoon announcing new rules for those coming back.
Citizens, permanent residents, and our families, any of the families returning from Europe will be subject to extra screening as well as self-isolation for a period of 14 days.
But many travelers were left bewildered by the president's initial announcement Wednesday, which didn't immediately say Americans are exempt from the ban.
Did it take you a while to figure out what the rules were?
Yeah, it's very confusing. It still is. There seems to be, if you go to one site for like the White House or the Department of State or Homeland Security, it seems like they're conflicting information.
Then it can be expensive. One family says they spent $8,000 for 3 one-way tickets.
You can argue about money later, but I feel like they were putting a price tag on people's safety, and that's scary, especially for people who can't afford it.
Das war ein grotesker Auftritt.
Tonight, one top German official calling the travel ban, quote, grotesque. The exodus from Europe comes as Italy begins a military airlift of patients after its deadliest day of the outbreak, 250 fatalities in 24 hours. In the United Kingdom, the number of cases soaring to nearly 800, and officials say they fear the real number may actually be 10 to 20 times higher. The Canadian Prime Minister, Justin Trudeau, announcing he will self-quarantine for 14 days after his wife tested positive for the virus after a recent trip to Britain.
I want to be clear, I have no symptoms, and I'm feeling good. Of course, it's an inconvenience and somewhat frustrating.
His wife Sophie thanking well-wishers, saying she'll be back on her feet soon. But tonight, the virus casting an even wider shadow across Europe. The Eiffel Tower and the Louvre closed until further notice. David, here in the UK, more than 200 new cases have been reported in just the last 24 hours. Just a few moments ago, President Trump said that he's looking at these new numbers and he may add the UK and potentially other nations to that list of banned countries. David?
All right, Maggie Rulli tonight. Maggie, thank you. Back here at home, President Trump, meantime, was asked late today, will he be tested for coronavirus? After this image from Mar-a-Lago just days ago, the president was with Brazilian officials, one of whom, on the right there with the hat on, tested positive for coronavirus. ABC's Terry Moran tonight with how the president answered.
In the Rose Garden, the president was quick to take credit for some of his administration's efforts on the coronavirus challenge, but when it came to all the problems with testing...
I don't take responsibility at all because we were given a set of circumstances and we were given rules, regulations, and specifications from a different time.
And the president was asked why his administration disbanded the National Security Office set up to prepare for pandemics.
When you say me, I didn't do it. We have a group of people. I could ask perhaps in my administration, but I could perhaps ask Tony about that because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
And what about the president's personal exposure to the virus? He's pictured here at Mar-a-Lago last weekend with a Brazilian official who's since tested positive. But the president has not been tested, nor has he isolated himself.
Are you planning to take any kind of precautionary measure to protect you and also your staff who was there
No,
with him?
We have No symptoms whatsoever.
Reporters kept pushing him, noting that other politicians who were at that same Mar-a-Lago event have quarantined themselves.
Well, I don't know that I had exposure, but I don't have any of the symptoms.
But there's no doubt the president was exposed. You can see it right there in the photo of him standing next to the infected Brazilian official.
But I have no idea who he is, but I take pictures and it lasts for literally seconds. I don't know the gentleman that we're talking about. I have no idea who he is.
The president's daughter and top advisor Ivanka Trump also had contact this week with an Australian official who has tested positive. Today, she worked. Meanwhile,
Thank you, sir. Thank you very much, sir. Appreciate it.
President Trump is still shaking hands, a lot, contrary to the public health guidance of his own administration and in full view of the American people.
Okay, I like that.
And late today, there is word that a second person who was at the president's Mar-a-Lago resort last weekend has tested positive for coronavirus. This is a donor at a Trump victory fundraiser. Every member of the First Family was at that fundraiser, as were members of the administration. A senior Trump campaign official says this donor who's tested positive has not had any interaction with the president. We've inquired if Mar-a-Lago is going to undergo a deep cleaning, and we're waiting for the answer. David?
All right, Terry, thank you. Meantime, at this hour, Congress now racing to approve a relief plan to help Americans, and there's word tonight of a breakthrough. Let's get right to Mary Bruce on the Hill tonight. Mary?
Well, David, House Speaker Nancy Pelosi has just announced that a deal has been reached. This is a bill intended to provide immediate relief. It includes free testing for the coronavirus, enhanced paid sick and family leave, and it would boost unemployment insurance. But it does not include measures that the president has been demanding, like a payroll tax cut. Now, this deal was intensely negotiated between the Speaker and the Treasury Secretary, the two of them speaking more than a dozen times just today. David.
All right, Mary Bruce on the breaking headline from the Hill. Mary, thank you. And there is still much more ahead on World News Tonight this Friday. Dr. Jen Ashton back to answer your questions. When should you get tested and how, and why are we so far behind? And what if you have an underlying health condition? We're also tracking a new line of storms tonight. The other news, the flash flood threat as the system now moves across the country just as we start the weekend. A lot more news ahead. I'll be right back.
Friday, March 13th.
Military hospitals could pick up some of the slack, but will that be enough? Adrian Adia is now on the race to respond.
Already crowded emergency rooms are now being stretched thin by people worried they have coronavirus, and doctors are sounding the alarm.
Hospitals are quickly getting filled up. We're probably at the tip of the iceberg at this point.
It could get worse. Researchers at Johns Hopkins University used government projections for a flu pandemic as a guide and estimate that 200,000 to 2.9 million people could need intensive care depending on the outbreak severity. But the U.S. only has 65,000 ICU beds currently available. Can we go inside?
Sure.
Like this isolation room at Chicago's Rush University Medical Center, where a coronavirus patient was recently treated. Dr. Brian Stein says they could scale up to 100 isolation rooms in hours.
We also have the ability to double up on beds, which would pretty much double our capacity to take care of patients with coronavirus.
Across the country, some hospitals are preparing outdoor facilities like these processing tents just for coronavirus patients, all in an effort to keep medical staff healthy and working. Adriana Diaz, CBS News, Chicago.
And we're going to continue to follow this story very closely. Coming up next, Steve Hartman with a politician's unexpected response to a message of hate.
Yes, Evening News. You can listen. Subscribe wherever you get your podcasts. Sponsored by ADT.
We're obviously...
This is a conversation we often do at the end of the week, but here we are thinking about the culture being affected.
Slam dunk savings on all TVs.
We even have special offers on soda mattresses and power bases.
We're going to continue to have thoughtful conversations as parents across the country.
There were employees who committed criminal.
Yeah, I think that Trump had lost control of the public discussion of this, and I think today he got it back. Before today, I think he was responsible for the single best action in all of this, which was the China travel restrictions, and the single worst action, which was losing control or falling behind on the whole testing issue, not taking that seriously enough and making it happen. And then after the primetime address on Wednesday night just did not work. There were errors in it. He looked nervous. The Dow just crashed the next day. And I think this was an entirely different event, as Jeff was saying. It was a really, really different feel to the event.
Meantime, he was asked about this coronavirus bill up on Capitol Hill. Here's how he responded and how one congressman was worried about it.
We just don't think they're giving enough. We don't think the Democrats are giving enough. We're negotiating. We thought we had something, but all of a sudden they didn't agree to certain things that they agreed to. So we could have something, but we don't think they're giving enough. They're not doing what's right for the country.
This has got a little some other social engineering stuff in it as well, Ed. So they put in $1 billion that wasn't subject to the Hyde Amendment, which means that you can spend up to $1 billion effectively on state-sponsored abortions, state-funded abortions. So it's hard to say yet what it's going to be.
Speaker Pelosi is saying she has a deal. Treasury Secretary Mnuchin says there's a deal. What we don't know is what's in the deal. And I don't think there's a lot of lawmakers up there on Capitol Hill who know what's in the deal.
Correct. I think lawmakers are clueless and trying to find out what's in the deal. And I don't think President Trump has yet agreed to the deal. I think we would see a tweet from President Trump if he had already agreed to the deal. We'll learn more about what's happening. I agree with you that the event at the White House was a positive step. I think at least it does one thing. It ends the debate over whether this is a serious problem or not, which for the past 4 weeks we've been having. And the president led a chorus, I think, of irresponsible commentary suggesting that this wasn't something that needed to be taken seriously, including a lot of talking heads. I hope that that is now settled. What we need now are facts. We need the president to lead on facts and to not provide bad information. I think it'd be better off if the president stepped back and let Mike Pence and let the medical professionals do the talking for him.
He did do that a number of times, bringing Tony Fauci up to the microphone, who has become this kind of really authoritative and plain-spoken in cutting through, not sugarcoating it.
For sure, and in fact, not sugarcoating it to the effect that to the point that he said this week that it had been a failure what had happened with the tests, and you didn't hear President Trump admonishing him for that. You didn't hear President Trump, expressing his.
And the question is whether this effort, and it seemed like they rolled it out really well about these companies, if they're going to get these tests going quickly.
Well, that's what they say. The CEO effort was good. The other thing that's been good in the last 48 hours or so is state and local governments are gearing up. I mean, for several days, Andrew Cuomo, the governor of New York, was complaining that we here in New York are ready to start some testing. We can get them some things done. The federal government won't let us. Now they can.
Yeah, the floodgates are open. Wish we had more time for winners and losers. Panel, thanks. When we come back, notable quotables. Been a long week, but it's Friday. That means notable quotables.
My fellow Americans.
Our hospitals, doctors, researchers, and public health officials are flying blind.
We would recommend that there not be large crowds. If that means not having any people in the audience when the NBA plays, so be it.
Civilization as we know it is at stake.
The likelihood of a recession globally right now is certainly above 50.
When you have a Democratic House and a Republican Senate, compromise is the name of the game.
Would it be working with companies and small companies, large companies, a lot of companies?
They're all more worried about Dow Jones than the Jones family.
Bottom line, it's going to get worse.
Let's shut this puppy down and let's move on and worry about November. This thing is decided. There's no reason to keep it going, but not even a day longer.
We got a whole lot of delegates to go.
I really thought we had a shot, but turns out I was about 40 years too young and 38 years too gay.
Your face lit up when I mentioned your grandkids. How old is the oldest grandkid? Like 60, 63?
Go wash your hands.
Practice that. Okay, I like that.
little chicken wing there at the press conference. This weekend on Fox News Sunday, Chris Wallace will speak with Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, and Treasury Secretary Steven Mnuchin. We'll find out details about what that deal is all about, if there is a deal. Check your local listings for air times. Thanks for inviting us into your home tonight. That's it for this special report. Fair, balanced, and still unafraid. Try to make it a great weekend, sports or no sports. The story, hosted by Martha McCallum, starts right now. Hey, Martha.
Hey there, Brett. Good evening to you. Thank you.
And if we had to, we can have a cart wheeled right into the room. It all runs off a wireless and is mobile.
Tight okay.
That's just 46,000 ICU beds. But a report suggests
Now, you're
we need ICU care, perhaps many more. Hospitals have 160,000 respirators on hand, but a pandemic like 1918 could require more than 742,000. Already, hospitals are reporting shortages of masks and protective clothing. The country's EMS system is also bracing for a surge in coronavirus calls. There are 21,000 EMS systems in the country. 60% of their calls are basic first aid. But when a patient is struggling to breathe,
all canceled blood drives just in a matter of days. That means the community blood bank needs some donations. If you'd like to help, you can donate blood at both Avera and Sanford hospitals. If you have a business that would like to help, you can find contact information under this story on KELOland.com. For all the latest information on the spread of the coronavirus, as well as any cancellations, closures, and postponements, head to our special coronavirus page at KELOland.com. We're constantly updating the site with the newest reports from South Dakota Health Department and WHO and the CDC, as well as state, local, and federal governments. You'll also want to join us for this weekend's Inside KELOland. It's Sunday night. We're asking an infectious disease doctor your coronavirus questions. Join us after the late local news.
We're not done yet with our COVID-19 team coverage. Coming up, what this pandemic means for upcoming events at the Denny Sanford Premier Center in Sioux Falls.
Wintry mix coming in from western South Dakota. It's going to be a cooler start to your weekend. Details on that next.
Many companies that can make these kits, so there's no reason why we can't have 5 million in a short period of time.
So, Dr. Wright, I spoke to John Gerace. He's the president of DSORM Molecular. So they're making tests, and he said they can make 300,000 tests a month once they get started, and they're doing that now. But he says there's an acute shortage of the raw materials needed to interpret those tests. So basically, all the people making the tests need to go to these suppliers to get a reagent, I guess, essentially the thing, in layperson's terms, you sort of dip it in to be able to interpret, is it positive or is it negative? Can this be resolved in time? How serious of a problem do you think this is as you look at it from a hospital perspective?
I think it's a very serious problem. That's what's limiting us right now. It's hard to tell if we're still in a phase where we can have few enough cases that we can contain it, or if it really is, as most of us suspect, spread through the community now and we need to move to a mitigation phase. So I think quickly we need more tests available, more reagents, so that we have the ability to do so. Many academic medical centers and independent laboratories are starting to develop their own tests because the government hasn't been able to provide it yet, although they're working hard and providing more. I know our state and Massachusetts received many more tests this week. So we're hoping it will open up. The question will be, will it be in time, or will we be moving to a phase where we don't test everyone because we assume many people have it, and restrict to people who are have other medical conditions, or in places like nursing homes or universities where a case hasn't been diagnosed yet, and we try to contain the spread there.
So Dr. Racknell, on this point, the president made it clear not everybody should take the test, and he made it clear. Here he is.
We don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it.
If you had the tests you needed, who would get a test?
First, people who are tested are people who are ill with respiratory symptoms. And then we want to make surveys throughout larger cities to see who else is infected. We have no idea right now how many other people besides the symptomatic ones are infected, and we need to know that to plan mitigation. We have no idea in cities or in rural areas.
Sort of like South Korea did, just in a sense there's some random testing.
Which they started in January, right? And that's why they were able to keep the numbers down.
So how big of an issue is this reagent issue? When you look at South Korea, I mean, I don't exactly understand the full supply chain here, but I can see that in certain places in the world, they appear to have that supply. They have the reagent and they're able to interpret the test. So why don't we?
Well, I mean, part of it initially, the tests that were sent out to what they call the point of care spots was a flawed test. So they didn't scale up that test. That was part of the problem initially. There's no reason why they shouldn't be able to create enough of this reagent. As you point out, they've done it in other places around the world. The test that was used in many countries around the world was developed in Germany, adopted by the World Health Organization, and then used in all these countries. We can do that as well, and in fact take it from a manual process, which takes a lot of time, to a more automated process, that high throughput process, which you kept hearing about today.
Right. All right, all of you, please stay with me. Next, one of the hardest hit countries, Italy. Italy now has more than
voluntarily do what's necessary. Cynthia McFadden, NBC News, New York.
We'll be right back in 60 seconds with more on the run on supplies, how big stores are responding as online sales skyrocket, and the tough choices facing houses of worship at this uncertain time.
First branch or online at servicefirstfcu.com.
A light rainstorm mix that doesn't look like a big deal is going to move through fairly quick.
You pay for what you...
I was interacting with them on a